Hello and welcome to the topic Pericarditis in the Cardiology module. By the end of this topic, you should be able to define pericarditis, outline the classification of pericarditis, describe the causes of pericarditis, explain the features of pericarditis, list out the investigations done to diagnose pericarditis, and discuss the treatment of pericarditis. Let's get started. So what is pericarditis? Pericarditis is the inflammation of the pericardium, which is the fibrous sac surrounding the heart. Pericarditis can be largely classified based on its clinical classification, which is acute pericarditis occurring less than 6 weeks, caused by fibrinous or effusive type, which could be serous or sanguineous. Subacute pericarditis, which occurs between 6 weeks to 6 months, and this is usually effusive in nature. Constrictive pericarditis also can occur as a subacute form. And finally, we have chronic pericarditis, which takes place at more than 6 months. The features are usually constrictive, effusive, or adhesive, which is non-constrictive in nature. Causes of pericarditis: similar to myocarditis, it can be caused by infections, viral infections such as Coxsackie B, bacterial such as tuberculosis, metabolic such as uremia or hypothyroidism, post-myocardial infarction, which is known as Dressler's syndrome, autoimmune causes, as well as malignancies. When it comes to investigations, ECGs are the first foremost investigation that can be done, and the changes in pericarditis are often global or widespread as opposed to the territories seen in ischemic events with saddle-shaped ST elevation. PR depression is the most specific ECG marker for pericarditis. All patients with suspected acute pericarditis should also have a transthoracic echocardiogram done. Apart from that, your inflammatory markers may also be raised as well. When it comes to management, begin with treating the underlying cause. A combination of NSAIDs and colchicine is now generally used for first line for patients with acute idiopathic or viral pericarditis. Let's talk about constrictive pericarditis in particular. It can be caused by any viral infections or bacterial infections, as we have explained earlier on. However, the commonest one would be tuberculosis. Features include dyspnea, right heart failure, where you might appreciate elevated JVP, ascites, edema, and hepatomegaly. The jugular venous pressure shows prominent X and Y descent. There will be a pericardial knock or a loud S3. And the Kussmaul sign is positive. For the chest x-rays, you may also look at pericardial calcification. The key differences between constrictive pericarditis and cardiac tamponade are summarized in the table in this slide. In summary, pericarditis is the inflammation of the pericardial sac or the outer lining of the heart. It is classified based on the duration of the condition, which is acute, subacute, and chronic. Constrictive pericarditis is subacute and chronic in nature, usually caused by tuberculosis. It can be differentiated from cardiac tamponade with the absence of Y descent in cardiac tamponade. Pericarditis can be identified from a transthoracic echocardiogram showing pericardial fluid collection. Management is aimed at treating the underlying cause, and supportive therapy with anti-inflammatory agents such as NSAIDs, aspirin, and colchicine. Occasionally, corticosteroids too. So we have come to the end of this topic. Thank you.